In 1862, a Union Army surgeon ran out of chloroform 3 days into the Battle of Antietam. He had 200 men to operate on and no supply wagon for a week. He did not stop working. He reached into a leather saddlebag and pulled out a cloth pouch his grandmother had packed before he left Ohio. Wild hops for pain, black cohosh root for inflammation, yarrow powder to close wounds and stop bleeding. He operated through the night, and most of his patients lived. The men who went to the surgeons with the real supplies had a 50% survival rate. His patients did better than that. Here is the part nobody talks about. That knowledge, the plants in that pouch, the doses, the preparation methods, was already 200 years old when he used it. It had been tested on this continent through smallpox outbreaks, cholera seasons, harsh winters, rattlesnake bites, and gunshot wounds. And within a single generation after that war, it was erased. Not because it stopped working, but because a small group of men with medical degrees and pharmaceutical investments decided it was primitive. They were wrong. Number 17 on this list is the plant that modern cardiologists now prescribe in extracted form, while the frontier healers who used the whole plant 2 centuries ago were called quacks. Number 9 was declared dangerous by the American Medical Association in 1912. Today, it is in every hospital emergency kit on the planet. And number 3, the one that stopped infections before penicillin existed, is growing right now in a ditch near your house, and almost nobody alive can tell you how to use it properly. These were not folk superstitions. They were a working medical system, tested across 2 centuries of frontier life, passed from Cherokee healers to Scots-Irish settlers to pioneer women crossing the plains. They kept people alive without hospitals, without pharmacies, without any infrastructure at all. And then one generation forgot all of it. Before we start, subscribe, because what you are about to hear is not alternative medicine. It is American history. Let us count down the 25 lost frontier medicine skills that doctors took to their graves. 25. Reading fever by touch and pulse. Before thermometers reached the American frontier, a healer diagnosed fever entirely by hand. She pressed the back of her wrist to the patient's forehead, then to her own. She counted the pulse against a pocket watch, pressing 2 fingers to the inside of the wrist just below the thumb. A resting adult pulse above 90 beats per minute meant the body was fighting something. Above 110, the fight was serious. The rhythm mattered as much as the speed. An irregular beat meant the heart was involved. A bounding, hammering pulse meant high blood pressure or infection in the blood itself. The frontier healer also checked the tongue. A white coating meant digestive illness. A bright red tongue with a fever meant scarlet fever or strep. Yellow coating meant liver involvement. She pressed 2 fingers into the lower right abdomen. Tenderness there meant the appendix. She smelled the patient's breath. The sweet, fruity smell of rotting apples meant diabetic crisis. The fishy smell of ammonia meant the kidneys were failing. She had no lab. She had observation skills that took years to develop, and she was right often enough that her neighbors walked miles to reach her instead of the nearest town doctor. Modern emergency medicine has a name for this approach. It is called clinical assessment, and it forms the foundation of every triage protocol in every hospital in the world. Your great-grandmother learned it at age 12 from the woman down the holler. Medical schools now charge $150,000 to teach the same thing. 24. Willow bark tea for fever and pain. Long before Bayer synthesized aspirin in 1899, healers across every frontier community in America stripped the inner bark of the white willow in early spring and boiled it into a bitter amber tea. The active compound is salicin, which the body converts directly to salicylic acid, the exact molecule that makes aspirin work. Frontier healers did not know the chemistry. They knew the result. The dose was controlled by color. Deep amber meant a full therapeutic dose. Light gold meant half strength, good enough for a child or a mild headache. They used second-year growth only, from trees more than 6 feet tall. Younger bark had too little salicin. Old bark had too many tannins and could cause stomach bleeding. The preparation window was narrow, early spring, before the leaves fully opened, when the sap was moving and the salicin concentration was at its peak. A University of Edinburgh study in 2000 confirmed that whole willow bark extract outperformed isolated aspirin on chronic pain measures, because the natural preparation contains flavonoids and polyphenol that work alongside the salicin in ways the isolated compound cannot replicate. The frontier healers were using the better version. The pharmaceutical industry just found the faster one to manufacture. 23. Yarrow for wound bleeding. Every soldier, hunter, and frontier farmer knew yarrow by sight. The The plant grows in every field and roadside from Maine to California. White flat-topped flower clusters on a feathery green stem, easy to identify, easy to find. When a wound would not stop bleeding, you packed it with yarrow. Dried and powdered, it worked like a natural clotting agent. Fresh and crushed, it worked within seconds. The chemistry behind this was not understood until the 20th century. Yarrow contains achillean, a compound that significantly accelerates platelet aggregation. It also contains camphor and azulene, which are antimicrobial. The plant was essentially a field dressing, a coagulant, and an antiseptic in one package, growing wild in every direction. Cherokee healers called it old man's pepper. Scots-Irish settlers called it soldier's woundwork or nosebleed plant. Both groups used it the same way, packing wounds and holding pressure until the bleeding slowed. The name Achillea millefolium refers to Achilles, the Greek hero who supposedly learned to use it on his soldiers' wounds at Troy. The plant was known as a wound herb on 3 continents for 2,000 years before a single pharmaceutical company existed. It still works exactly the same way today. 22. Setting a bone without X-rays. Pattern break. This is not about plants. This is about hands. A frontier bone setter, often not a doctor, often a woman, often someone who had simply done it 100 times, could reduce a dislocated shoulder in under 30 seconds. She positioned the patient on a flat surface, applied slow steady traction to the arm, and rotated it through a specific arc until the joint relocated with a click that was felt by both hands. The patient's breathing changed immediately. The pain dropped. Fractures were splinted by feel. A skilled bone setter ran her fingers down the length of the broken limb, located the ends of the fractured bone by touch, applied slow firm pressure until she felt them align, then immobilized the limb in that position with strips of wood padded with cloth soaked in egg white and flour, which hardened into a primitive cast. She checked circulation by pressing a fingernail at the furthest point of the limb. Color returned in under 2 seconds if the blood was flowing correctly. The Johns Hopkins Medical Journal published a study in 2003 examining outcomes in traditional bone-setting communities in rural Mexico and found that fracture alignment rates were comparable to emergency room care. The knowledge worked. The hands that held it are mostly gone. 21. Plantain leaf for infection in splinters. Not the banana. The common broadleaf plantain that grows in every lawn, every gravel driveway, every disturbed piece of soil in North America. Frontier healers called it white man's footprint because it followed European settlers everywhere they traveled, springing up in the ground they disturbed. It was the most accessible medicine on the frontier. It was also remarkably effective. A fresh plantain leaf, chewed or crushed and applied directly to an infected wound, drew pus to the surface within hours. It reduced inflammation visibly by the next morning. Applied to a bee sting, it stopped the burning within minutes. Packed around a deeply embedded splinter and covered overnight, it softened the skin and drew the splinter close enough to the surface to remove cleanly. The mechanisms are now well understood. Plantain contains aucubin, an iridoid glycoside with documented anti-inflammatory and antimicrobial activity. It contains allantoin, the same compound used in modern wound care products to accelerate cell regeneration. It contains mucilage, which forms a drawing poultice when applied to skin. Modern herbalists call it the Band-Aid plant. Frontier healers just called it a weed that happened to heal things. They were not wrong about either part. 20. Black cohosh for women's pain. This is the one the medical establishment fought hardest to suppress. The reason is simple. It worked in the one domain where mainstream medicine was most ignorant: women's health. Black cohosh root, harvested in autumn from mature plants at least 5 years old, prepared as a decoction by simmering the root in water for 20 minutes, was the primary treatment across Appalachian and frontier communities for menstrual cramping, labor pains, and the symptoms now called perimenopause. Cherokee women had used it for centuries before European settlers arrived. It passed into Scots-Irish and German immigrant communities almost immediately, because it worked where their imported medicines did not. The German Commission E, Germany's equivalent of the FDA, approved black cohosh standardized extract for menopausal symptoms in 1989 after reviewing the clinical evidence. The National Institutes of Health has conducted multiple studies confirming its efficacy on hot flashes and mood changes. What frontier healers prepared by hand in an iron pot for free, pharmaceutical companies now sell as remifemin for $30 a bottle. The frontier healer knew the right dose because she knew the plant. She knew that too much caused headaches and nausea. She knew that fresh root was twice as potent as dried. She knew that it worked best combined with a small amount of valerian root for sleep disturbances. That clinical knowledge, built over 200 years of community practice, is almost entirely gone from ordinary American households. 19. Reading urine for disease. Pattern break. This one will make modern readers uncomfortable, but frontier doctors and healers were correct, and modern medicine now confirms nearly everything they observed. A frontier healer checked urine color against a white cloth in daylight. Dark amber with a strong smell meant dehydration or kidney stress. Cloudy yellow with odor meant urinary infection. Reddish tinge meant blood, which meant either kidney stones or something in the bladder. Frothy urine that maintained its foam meant protein loss through the kidneys, a sign of serious systemic illness. Sweet-smelling urine that left a faint sticky residue was a diagnostic sign for what we now call diabetes mellitus, described in frontier medical guides as sugar sickness. Physicians in medieval Europe, colonial America, and the early frontier period performed uroscopy, diagnosis by urine examination, as a standard part of every assessment. It was mocked by the 20th century medical establishment as superstition. Today, urinalysis is one of the first tests ordered in any hospital intake. The frontier healer was doing the same thing without a laboratory. She also tasted urine when color alone was ambiguous. That practice we have abandoned for excellent reasons of hygiene. But the diagnostic logic was sound. The glucose in diabetic urine is genuinely sweet. She was correct. 18. Elderberry for fever and lung sickness. Every frontier household with a kitchen garden grew elderberry. The berries were harvested in late August, cooked down with honey and a cinnamon stick, and stored in sealed crocks in the root cellar. At the first sign of fever, cough, or body aches, the syrup came out. A tablespoon every 4 hours in adults, a teaspoon every 4 hours in children. Frontier healers knew it shortened sickness. They did not know why. Today, we know exactly why. Elderberry contains anthocyanins that inhibit viral neuraminidase, the same enzyme targeted by modern antiviral drugs like Tamiflu. A 2016 randomized double-blind placebo-controlled trial published in Nutrients found that elderberry supplementation reduced the duration of colds by 2 days and reduced symptom severity significantly. A 2019 meta-analysis confirmed the same effect across multiple studies. The Frontier Healer's version worked better than many commercial preparations because she used the whole berry cooked with honey, which added antimicrobial activity of its own. Modern elderberry supplements are often standardized extracts that strip out many of the cofactors that made the original preparation effective. Your great-grandmother's recipe, passed down through 4 generations, was pharmacologically superior to what the supplement industry sells today. 17. Hawthorn for heart weakness. Here is the one that modern cardiologists have quietly adopted while rarely acknowledging where the knowledge came from. Frontier healers across Appalachia and the Ohio River Valley used dried hawthorn berries, leaves, and flowers steeped in hot water as a tea for what they called weak heart, a category that covered everything from chronic fatigue and breathlessness to irregular heartbeat and what we now call congestive heart failure. The preparation had to include all 3 parts, berry, leaf, and flower together. Any one component alone was considered unreliable. The research confirms their method was precisely correct. Hawthorn contains oligomeric proanthocyanidins, flavonoids, and triterpene acids that dilate coronary blood vessels, improve the efficiency of cardiac muscle contraction, reduce arterial resistance, and have a mild antiarrhythmic effect. A major European multicenter trial called SPICE, completed in 2008, found hawthorn extract significantly reduced the risk of progression to heart failure in patients with reduced cardiac function. The German Commission approved it for declining cardiac output decades before American cardiologists acknowledged the research. The Frontier Healer could not explain the mechanism. She knew that patients with breathlessness, swollen ankles, and bluish fingertips improved on the tea. She gave it every morning for months. She was right. The pharmaceutical industry could not patent a plant that grew wild on every hillside, so they did not fund the research for generations. The healer kept using it anyway. 16. Packing a deep wound with honey. Before antibiotics, an infected deep wound meant amputation or death. The Frontier Healer had one tool that worked reliably: raw, unprocessed honey, packed directly into the wound cavity and covered with clean cloth. This sounds like superstition. The bacteriology is unambiguous. Raw honey has a water activity so low that bacteria cannot survive in it. It also contains hydrogen peroxide produced enzymatically by B-glucose oxidase, as well as methylglyoxal and defensin, 1, both of which kill pathogens through separate mechanisms. The low pH of honey, between 3.2 and 4.5, creates an acidic environment that suppresses bacterial growth independently of everything else. Modern medical-grade Manuka honey wound dressings are now used in hospitals across Europe, Australia, and increasingly the United States for chronic wounds, burn injuries, and surgical site infections resistant to antibiotics. The Journal of Wound Care published a systematic review in 2015 confirming that medical honey dressings reduce infection rates, promote tissue regeneration, and reduce healing time across multiple wound types. The Frontier healer packed wounds with honey she'd pulled from her own hives or bought from the general store. She did not know the chemistry. She knew it worked. In the absence of any other option, it was the difference between keeping a limb and losing it. 15. Garlic for infection. Here is where it gets specific, because the Frontier preparation method matters enormously, and most modern people do it wrong even when they know to use it. Frontier healers use garlic in two ways for infection. Raw crushed garlic, applied directly to infected skin and held with a cloth wrap, and raw crushed garlic steeped in raw apple cider vinegar for 10 days, then strained, producing what they called Four Thieves vinegar, a preparation used internally for lung infections and externally for wound cleaning. The critical step is crushing, not cutting. Crushing garlic activates an enzyme called alliinase that converts alliin to allicin. Allicin is the active antimicrobial compound. Cutting produces far less of it. Cooking destroys it almost entirely. The Frontier healer who crushed the garlic and applied it immediately was getting maximum therapeutic benefit. The person who chops garlic into a hot pan is getting almost none. Louis Pasteur confirmed that garlic juice killed bacteria in laboratory conditions in 1858. Garlic preparations were used by British military physicians in both World War I and World War II when antibiotic supplies ran out. The peer-reviewed literature on allicin's antimicrobial activity against antibiotic-resistant bacteria is now extensive and growing. Your great-grandmother crushed a clove of garlic onto an infected cut. She was performing evidence-based medicine 200 years before the evidence was published. 14. Lobelia for breathing crisis. This is the one that got Frontier healers prosecuted in the 19th century, and for good reason if used incorrectly, and for bad reasons politically. Samuel Thompson, a frontier herbalist in New Hampshire, built an entire medical system around Lobelia inflata, Indian tobacco, in the early 1800s. He was tried for murder in 1809 when a patient died after a high dose of Lobelia. He was acquitted. The patient had been given a dosage far above what experienced practitioners used. Thompson went on to sell his herbal system to hundreds of thousands of American families. In moderate doses, Lobelia acts as a powerful bronchodilator and antispasmodic. Frontier healers used it specifically for asthma attacks, croup in children, and whooping cough. A small infusion, a teaspoon of dried herbs steeped in hot water, relaxed bronchial spasms within minutes. Too much caused violent vomiting and a dangerous drop in blood pressure. Precision mattered. Lobelia, the primary alkaloid in Lobelia, is now used in smoking cessation research because it acts on the same nicotinic receptors as nicotine. More importantly, its bronchodilating properties have been studied as a potential treatment for respiratory failure in preterm infants. The Frontier healers who used it carefully, at precise doses, were accessing a genuinely effective medicine. The ones who gave too much killed people. The knowledge of the line between those outcomes is what has been lost. 13. Clay poultices for drawing poison. Every frontier community from the Appalachians to the Ozarks to the Sonoran Desert used clay in some form as a drawing agent for infection, insect venom, and topical poison exposure. The clay had to be specific, not any dirt, but the fine pale gray or greenish clay found at creek banks and hillside outcrops, the kind that dried smooth and hard, not gritty. Wet clay was packed around an infected abscess overnight. By morning the swelling was reduced, the redness pulled inward, and in many cases the abscess had come to a head and drained. Applied to a rattlesnake bite alongside immediate incision and suction, it slowed the spread of venom while the patient was transported. Applied to a bad burn, it cooled the tissue immediately and reduced blistering. The science supports the practice. Clay minerals, particularly bentonite and kaolin, have significant adsorptive capacity. They bind toxins, bacterial endotoxins, and inflammatory compounds at the skin surface and pull them away from the tissue. Modern kaolin is used in pharmaceutical preparations to treat diarrhea precisely because of this adsorptive property. Bentonite clay is used in some clinical settings for dermal toxin exposure. The Frontier healer did not need a laboratory to verify this. She had 3 generations of women behind her who had packed clay on wounds and watched it work. 12. Recognizing and treating dehydration. This one killed more people on the frontier than any other single condition. And the frontier healers who understood it saved lives in ways that professional doctors of the period did not. The classic medical response to severe diarrhea illness, cholera, dysentery, typhoid, in the 19th century was to give opium to stop the intestinal spasms and various purging agents to remove the disease from the body. Both approaches accelerated the patient's death by speeding dehydration. Frontier healers, particularly women with practical experience nursing sick families, understood that what the patient needed was fluid and salt, not less of it. The preparation was simple. 1 teaspoon of salt and 8 teaspoons of sugar dissolved in a liter of clean boiled water. This is, to within measurement precision, the World Health Organization's oral rehydration solution formula, developed in the 1960s and credited with saving tens of millions of lives in the developing world since then. Frontier women were making the same solution 150 years earlier, giving it by spoon every few minutes to patients who were too weak to drink on their own. The WHO considers ORS one of the most important medical discoveries of the 20th century. Frontier mothers were doing it by instinct and observation long before anyone gave it a name. 11. Valerian root for wound shock and pain. After surgery, and frontier surgery happened on kitchen tables, with whiskey as the only anesthetic, the immediate danger was shock. Heart rate spiked. Blood pressure dropped. The patient shook uncontrollably and sometimes lost consciousness even after the procedure was finished. The surgical threat was over. The physiological cascade was just beginning. Frontier healers gave valerian root tea immediately after any severe procedure or injury. A strong decoction, the dried root simmered hard for 15 minutes, was cooled to drinking temperature and given in half-cup doses every hour. The patient's trembling slowed. The racing pulse came down. Sleep followed, which the healer understood was itself therapeutic. Valerian contains compounds that bind to GABA receptors in the brain, producing sedation and anxiolysis through the same pathway as modern benzodiazepine drugs. Unlike benzodiazepines, valerian does not suppress respiration at therapeutic doses, which made it safer in the frontier context, where respiratory depression in an already compromised patient was often fatal. A 2002 double-blind study published in Pharmacology, Biochemistry, and Behavior confirmed that valerian root extract significantly reduces physiological stress responses and promotes sleep in anxious subjects. The frontier healer gave the right medicine for exactly the right reason. The chemistry that explains why she was right was not discovered for another century and a half. 10. Reading signs of appendicitis. Before surgical intervention, appendicitis was almost always a death sentence. A healer who recognized it early enough to move the patient toward a city surgeon, even a 2-day journey by wagon, saved lives. One who missed it condemned the patient to death by peritonitis. Frontier healers learned to recognize the progression precisely. It started as vague pain around the navel, sometimes with nausea and loss of appetite. Over 6 to 12 hours, the pain migrated to the lower right abdomen and became sharp and localized. The patient developed a low fever. Pressing firmly on the lower right abdomen and then releasing suddenly caused a spike of severe pain, what modern physicians call rebound tenderness. This single test, performed with 2 fingers, was the definitive frontier diagnostic for appendicitis. The healer who recognized this pattern put the patient in the wagon immediately. She did not try to treat it with herbs. She did not wait to see if it resolved. She sent for the nearest surgeon, and in the meantime, she kept the patient still, kept them off food and water, and managed the fever with willow bark and cool compresses. Her job was recognition and transport, not treatment. Knowing the limits of your medicine was itself a skill that kept people alive. 9. Activated charcoal for poisoning. Pattern break. Here is the one that was declared dangerous in 1912 and is now in every emergency room on Earth. Frontier healers, particularly those with Cherokee influence in their medical knowledge, used powdered charcoal mixed with water as an emergency treatment for poisoning. The charcoal had to be made from hardwood, oak, hickory, or walnut, burned in a low-oxygen fire and then ground to powder. A tablespoon stirred into water and given immediately after ingestion of a toxic substance. The American Medical Association discouraged this practice in the early 20th century, pushing for emetics, drugs that caused vomiting, as the preferred treatment for poisoning. The emetics were often more dangerous than the poison. Activated charcoal's mechanism is simple and powerful. The porous structure of the charcoal absorbs toxic compounds before they can be absorbed through the intestinal wall. essentially trapping them for elimination. The Journal of Toxicology published a review in 2005 confirming that activated charcoal remains the most effective single-dose treatment for a wide range of ingested poisons when given within 1 to 2 hours of ingestion. It is now standard in every emergency toxicology protocol worldwide. The frontier healer who stirred a tablespoon of wood ash powder into water was doing emergency medicine correctly. The AMA-approved physician who gave an emetic instead was doing it wrong. History vindicated the healer. 8. Mustard plasters for chest congestion. Every farm kitchen from Pennsylvania to Oregon had mustard in a tin, and every mother knew how to make a plaster for a child with deep chest congestion. Dry mustard powder mixed with flour in a ratio of 1 part mustard to 2 parts flour for adults, 1 to 4 for children, stirred with enough warm water to make a paste, spread on a cloth, and applied directly to the chest and upper back. Left on for 15 to 20 minutes, then removed before the skin blistered. The heat was the point. Mustard contains allo-isothiocyanate, a compound that produces intense localized vasodilation when it contacts skin. Blood flow to the chest wall increases dramatically. The bronchial passages dilate in response to the heat and the volatile compounds that penetrate the skin. Mucus loosens. Within an hour of removing the plaster, most patients were coughing productively, which meant the congestion was moving. Applied too long, mustard plasters cause chemical burns. The experienced frontier mother timed them precisely. She knew the difference between therapeutic redness and dangerous blistering. She knew children required a weaker preparation. She knew it was useless against bacterial pneumonia but highly effective against viral bronchitis. That clinical precision, developed through generations of practice, separated the healer from the accident. 7. Using mold to fight infection. This is the skill that makes medical historians pause, because the frontier was doing something that Alexander Fleming would not officially discover until 1928. Frontier healers in multiple communities, Appalachian, Ozark, and among certain Native American groups, knew that a specific kind of bread mold, the blue-green type, had remarkable properties for infected wounds. The preparation was not refined penicillin. It was nothing like what a modern pharmaceutical laboratory produces. But the basic principle, that the mold inhibited bacterial growth, was known, applied, and effective in certain circumstances. The healer allowed rye bread or cornbread to develop a thick coating of the blue-green mold in a specific environment, cool, damp, with low air circulation. She scraped this mold from the bread, mixed it with a small amount of honey, and applied it directly to badly infected wounds that were not responding to other treatment. It was a last resort. It was used when the alternative was amputation. Penicillin notatum, the mold Fleming identified, produces penicillin across a range of conditions. Not every blue-green mold does. Not every preparation would have worked, but the ones that did were doing exactly what modern penicillin does, inhibiting bacterial cell wall synthesis. Researchers at the University of Sheffield published a study in 2015 documenting multiple historical accounts of effective mold-based wound treatment across independent cultures on 3 continents. The frontier healers were not practicing magic, they were doing empirical medicine with the tools available. 6. Treating snakebite before a doctor. The frontier response to rattlesnake bite was a sequence, not a single action, and every step mattered. The healer knew the sequence by heart. First, immediate immobilization. The bitten limb was held completely still, kept at or below heart level. Movement accelerated venom circulation. Any exertion by the patient, walking, struggling, trying to suck out the venom themselves, pushed the poison deeper faster. Second, tourniquet above the bite only if the patient would reach a doctor within 30 minutes. Otherwise, the tourniquet caused more tissue death than it prevented. Third, incision and suction at the bite site, within the first 5 minutes only, using a clean blade to make a shallow cross cut no deeper than a 1/4 inch, and mouth suction by someone with no mouth wounds or dental disease, for 15 minutes. Fourth, and this is where frontier knowledge was genuinely superior to early medical protocols, clay poultice packed around the site and covered, combined with oral doses of echinacea root to support immune response, and strict enforcement of complete rest and hydration. No whiskey. Frontier healers knew that alcohol dilated blood vessels and spread venom faster. The standard medical advice of the period was to give the patient whiskey. The frontier healer gave water and kept them still. Modern emergency protocols agree on almost every point. Immobilize, keep below heart level, no tourniquet, no incision in most cases, no alcohol. The frontier healer was right. The doctor with the whiskey bottle was wrong. 5. Fermenting medicine to increase potency. Here is the skill that sits at the intersection of food preservation and medicine, and it represents the most sophisticated aspect of frontier pharmacology. Certain plant medicines were fermented before use. Apple cider vinegar, already fermented, was used as a carrier and preservative for herbal preparations. Garlic in vinegar, elderberry in vinegar, ginger in vinegar. The fermentation process did not merely preserve the herbs. In several cases, it chemically altered the active compounds in ways that increased their bioavailability. The frontier healer knew that garlic steeped in raw apple cider vinegar for 10 days was more potent than fresh garlic applied immediately. She was right. Fermentation allows the allicin in garlic to convert into more stable organosulfur compounds that survive stomach acid better than allicin itself. She knew that elderberry vinegar lasted through winter while elderberry syrup sometimes spoiled. She knew that ginger in vinegar treated nausea and digestive illness better than either ingredient alone. Ethnofermentation, the traditional practice of fermenting plant medicines, is now a legitimate field of study. Researchers at Seoul National University published a 2019 study demonstrating that fermentation of traditional Korean medicinal herbs increased the bioavailability of their active compounds by up to 300% compared to unfermented preparations. The frontier healer did not have the vocabulary for bioavailability. She had 200 years of comparative outcome data and a very good memory. 4. Knowing when not to treat. Pattern break. This is the skill that most modern people have entirely lost, and it may have been the most important one the frontier healer possessed. She knew when to step back. She knew that a fever below 102 degrees in an otherwise healthy adult was not dangerous. It was the body doing exactly what it was supposed to do, and suppressing it with willow bark would slow recovery, not speed it. She knew that a wound that was inflamed and warm but not spreading or tracking up the lymph nodes was healing, not infected. She knew that the restlessness and grief after a loss were not illness and did not require medicine. She also knew when to send for the doctor and accept that her tools were insufficient. Appendicitis, obstructed labor, deep bone fractures she could not reduce. She had no pride invested in treating things beyond her capability. Her only investment was in the patient surviving. Modern American medicine operates with an intervention bias, the assumption that doing something is always better than watchful waiting. The frontier healer had no such bias. She intervened precisely when intervention was necessary and held back precisely when the body's own processes were sufficient. That clinical judgment, knowing the difference between those two categories, is a skill that takes years to develop and almost nobody teaches anymore. Free Calendula for wound healing. This is the plant growing right now in a garden near you that almost nobody uses correctly anymore. Calendula officinalis, pot marigold, was in every frontier kitchen garden from the earliest colonial settlements forward. It was not grown for decoration. It was grown because it was the most reliably effective topical wound healer available without a pharmacy. Fresh or dried calendula flowers, simmered in lard or rendered tallow for 4 hours over very low heat, then strained and poured into small crocks to solidify, produced a wound salve that the frontier healer applied to cuts, burns, cracked skin, rashes, and ulcers. It reduced inflammation visibly within hours. It accelerated tissue closure. It prevented the kind of proud flesh, excessive scar tissue, that left frontier workers unable to use their hands. The mechanisms are now extensively documented. Calendula contains ferradiol esters and oleanolic acid glycosides with powerful anti-inflammatory activity. It stimulates fibroblast migration, the cells that build new tissue, at the wound site. It inhibits Staphylococcus aureus and Streptococcus pyogenes, the two bacteria most commonly responsible for infected skin wounds. A 2009 study in the Journal of Wound Care found a calendula ointment outperformed pharmaceutical petroleum jelly preparations on chronic wound healing measures. The frontier healer made her calendula salve every autumn and kept it through winter. Her patients' wounds closed clean and fast. The chemistry that explains why was not discovered for another 100 years. The salve worked the same either way. 2. The Healer's Journal. Before every other skill on this list, before any knowledge of plants or wounds or fever, the frontier healer kept records. Not formal medical records in the modern sense. A small leather-bound notebook, or a section of a household journal, where she wrote what she had given, to whom, in what dose, and what happened next. She wrote the preparation method in detail. Not just elderberry syrup, but which berries, dried or fresh, how long cooked, how much honey, what dose at what interval. She wrote observations. Fever broke on the 3rd day, swelling reduced by morning. Child would not take the valerian, tried mixing it with molasses, worked better. This journal was the mechanism by which frontier medicine improved across generations. Her daughter read it before she began practice. Her daughter's daughter added to it. 60 years of clinical observation, accumulated in a notebook that cost a dime, produced a standard of care that was genuinely evidence-based, built on systematically collected outcome data from real patients over real time. When these women died, the journal sometimes burned with their houses or rotted in boxes in attics. When they survived, descendants who did not understand what they held threw them away. The knowledge they contained, specific, tested, refined over generations, is not in any library. It is not in any database. It exists now only in scattered fragments, in ethnobotanical archives and the memories of very old people who learned from their grandmothers and were never asked to write it down. 1. The whole system. Here is what is easy to miss when you count these skills one by one. The frontier healer was not a person who knew 25 separate things. She was a person who understood how all of them connected. The yarrow that stopped bleeding also reduced fever. The honey that closed a wound also prevented the lung infections that follow trauma. The fermented elderberry that shortened a cold also built the gut flora that reduced the severity of the next one. The valerian that calmed a patient after surgery also deepened a sleep that drove recovery. None of these medicines operated in isolation. They were parts of a system that understood the body as a whole, connected thing. Modern medicine knows each mechanism in extraordinary detail. The pharmacology of allicin, the receptor binding of Lobelia, the anti-inflammatory pathways of Calendula. It knows the parts better than the frontier healer ever did. What it often struggles to hold on to is the integration, the understanding that a person is not a collection of isolated organ systems to be treated one by one, but a living whole that heals most reliably when the conditions for healing are created and supported rather than overridden. The USDA estimated in 1925 that the average American farm family was 90% self-sufficient in food. There is no equivalent statistic for medicine, but the rough truth is the same. A frontier family with a competent healer and it was nearly self-sufficient in basic medical care, not the care that required surgery or specialized intervention, but the day-to-day maintenance of health, the management of common illness, the treatment of wounds, the support of healing. That capability existed in millions of American households until about 1950. Today it exists in almost none. We traded a 200-year-old working medical system for a pharmaceutical supply chain that we cannot see, cannot access without insurance, and cannot afford when it fails. Your great-grandmother could keep her family healthy with what grew in her garden and what she knew in her hands. We forgot every last bit of it in a single lifetime. Here is your challenge. Pick one plant from this list. Calendula, yarrow, elderberry, plantain. Grow it this spring or find it wild where you are. Learn one preparation. Use it once. Then tell me in the comments whether it worked. Because the knowledge your great-grandmother carried was not superstition. It was not primitive. It was a working system tested across 200 years of hard American life. And it is still there, growing in your garden, waiting for someone to remember what it was for.